Hi everyone, Annie Mills here. We're going to talk about how to create and use templates for taking dental x-ray, and this is going to help speed up the process considerably when we use templates in Progeny. And all softwares have the capacity to do this, so if you're not using Progeny, get with your tech support to find out how to use these, create them. You can make your own. And we're going to start here. A couple of things. Make sure that you're in a patient and that your x-ray is hooked up so we get this green light here so that this dental chart is live, not grayed out, because we're going to be using that to make a template and create a template. So we're going to start with a small dog template, and I'm just going to make this larger just so it's easier for everyone to see. And you can see this is the triad numbering chart here that we've got, where the patient's right side is on our left and the patient's left side is on our right. It says the patient's looking at us. And we're going to begin to build this template. We're just going to start clicking and dragging and choosing teeth for the appropriate shots. And you can see that first shot was molars and premolars. Second shot is the canine. Third shot is all of the incisors. Fourth shot is that left canine, and so on. And you can see as we're choosing these teeth that the software is automatically numbering these, and this is the order that we'll take these shots. Now, once we've got everything highlighted, we're going to right click and save as template. We'll name it small dog. And then once we do that and click OK, it will take us into the template manager. And once we get into the template manager, all we have to do is arrange these boxes into a nice, neat arrangement. So we'll start with the right caudal maxilla, our incisors, and just make sure that you're putting these in the right order. And you can copy this exactly how I'm doing here. This is the small dog. I use this for small dogs and cats. Same views for both species. And you can certainly make this in a cat chart. You just have to be in a feline patient. Same technique. So this is our small template. Once we hit save, then it will save that template and it will be available here in this drop-down menu if you're in a canine chart that you can use for future patients. Now, as we move through this, we'll go ahead and see this is what it looks like when it is populated after we've taken our x-rays, and it just is a nice arrangement, not only to evaluate x-rays, but when we're doing our dental charting, this is how we look at x-rays in this arrangement, as opposed to looking at them one at a time as single views. This way we know we're going in order around the arch on the top and around the arch on the bottom, and following along on our dental chart so we're not missing anything. So we highly recommend viewing and evaluating and making notations on your dental chart with the teeth, with the x-rays arranged in this template arrangement. Makes the process go by much quicker. So let's look at a large dog. There's another way to make a template. We can click on this 4-box icon, and this will take us directly into the template manager. We'll click on New. That will give us a blank field to work on. And we'll name this large dog. And this is going to be a total of 19 spots that we're going to create here. And all we have to do is just click and drag the appropriate boxes here. So my first box is going to be molars. My second and third is going to be premolars. My fourth is going to be the canine. And then I'm going to choose right incisors, and then I'm going to choose left incisors. And if you've taken my course or seen my videos, you know that in large dogs we need 2 shots for the maxillary incisors because they diverge as they go into bone. And if we try and do them in one shot, those lateral incisors are going to get cut off. So we simply take them in 2 shots. So continuing on here, we're on our left quadrant, maxillary left quadrant, and we'll just repeat that same pattern on this side. And again, you can follow along and create a template just like this. I use this on all patients, typically over 35-40 pounds, depending on the breed. So I have enough boxes. I don't have to guess, is this a small dog? Is this a large dog? I just grab my large dog template, and it gives me enough spots to take all of these x-rays, anything over 40 pounds all the way up to 200 pounds. I've used this particular template. So we're in the left caudal mandible now, and again, choosing the appropriate boxes here with our molars, premolars, and then of course our canine shot. For our maxillary incisors, we're going to choose a lower anterior. We only need 1 box. And in any size dog, we can get mandibular incisors always in 1 shot because those incisors come together as they enter the bone, as opposed to the maxillary incisors that diverge when they enter the bone. So we just need the 1 box. And you'll notice that some boxes are in landscape, some boxes are in, the incisor boxes are in portrait. That's important so that they're in the right orientation when we are viewing our completed template. So once we have completed all this, and you'll see that we're not able, or the software won't let us put an upper in a lower, or a lower in an upper. It won't let us put a left tooth in a right quadrant, so it makes it very nice. We also have the ability to move boxes around or renumber or remove boxes in case we make a mistake, so we don't have to start completely over. Just right click and it brings that box up with those commands. We'll go ahead and hit our save button again, and then this will put it in that drop-down menu as well, so we'll have access to that for all future patients in the canine chart. So that's just a really nice, easy way, pretty foolproof as far as putting these together because the software is fairly intuitive and it won't let us put the wrong teeth in the wrong quadrant, so we're confident that our template's going to be correct. And this is what our completed template looks like with all of those boxes populated. Very nice, easy, organized to, again, evaluate and then create your dental chart. So let's go ahead and make our last template here. I do have a medium dog template. I don't use that as often as a small dog or a large dog, but it's nice to have. So again, we'll just start clicking and dragging and highlighting the teeth that are going to create our numbered boxes. And essentially, I'm just adding 1 x-ray in each quadrant to cover the premolars in a medium dog. And then once we complete this, this will be a 14 spot template. And so this is nice for those in between kind of larger, smaller dogs, corgis, Shiba Inu, maybe a medium beagle type breeds. So those in between breeds that a small chart just won't cut it, but we don't need the large chart with all of those extra spots. So again, we'll just arrange this so it's a nice, neat layout, and we have our medium dog template. So let's take a look at this, what it looks like in a live patient. We're going to choose our large dog template here, and we're going to hit our start stop acquisition button right here. That will start our exposure, and you can see that the first box with the corresponding teeth and the corresponding box start to blink. That lets us know we can take our first shot. and we take our x-ray, and the box will populate with our x-ray, and and then we'll automatically go to the next box. We don't have to do anything with the computer. It just automatically, the next box and the next set of teeth will start to blink. We'll take our x-ray, and that box will populate, and then we'll continue on here. And I have a number of people ask if we're able to repeat x-rays. We've taken a shot that is not diagnostic, and can we take that shot over? And yes, absolutely. So a lot of times that'll happen with the canine. Sometimes we don't have our sensor positioned correctly, and we don't get the apex of that canine, for instance. So here's a shot that is not diagnostic. I'm going to need to take that over. So the first thing I'm going to do, I'm going to hit this pause button, pause acquisition, and we'll hit that. I'm going to go up to the corresponding box and right click to give us this box that lets us either add or replace. And I typically do a replace, and then it automatically starts to blink again, and then I'm able to repeat my shot and get a diagnostic view in my next shot by moving my sensor in the right spot. And there we have it. And then I can just continue on from there. So when you're taking dental x-rays and you're at the point where you've practiced enough where you can get a diagnostic view in all teeth in 1 or 2 shots, maybe even 3 shots in some occasions, then you're absolutely ready for templates. If you're still struggling where you're taking shot after shot after shot and not having the diagnostic view you want, you might need to get some training and some troubleshooting help. But once you get to the point where you're able to take all of these in 1 or 2 shots, then you're absolutely ready for templates. Thanks for watching, and I hope this was helpful.